Sego, I am District Chief Tobi Mitchell, and I serve as a portfolio member for MCA's Department of Health. I'm coming to you today as a leader, as a granddaughter of a resident in a long-term care facility, and as a member of our community who values the lives of our people. The Department of Health provided an update to the community about the increased restrictions for our long-term care facilities, which includes prohibiting the public from the grounds of each facility. I want to remind you that this is a temporary measure. It's not permanent. I know that we would all like to see our dudas and elders, but right now we have to ask the public to stay away from these facilities. The MCA Department of Health screens through the Ontario Ministry of Health directives every day, implementing a number of protocols and procedures to keep our community safe. First Nations are considered a high-risk population for COVID-19 because of the high rate of individuals with respiratory issues like asthma, heart disease, and diabetes. Long-term care facilities are also considered a high-risk population for COVID-19 because of the age of the residents, the proximity within the homes, and pre-existing medical conditions. In Ontario, of the 1,300 reported deaths from COVID-19 cases since January, 927 of those deaths happen in a long-term care facility. In Quebec, of the 2,205 reported deaths from COVID-19 cases since January, 91% of those deaths were individuals over the age of 70. We don't want Akwesasne to become one of these statistics. Department of Health administration and healthcare workers in each long-term care facility work together to make sure we have healthy staff to maintain operations and care for our elders. A lot of work happens behind the scenes to take on the additional protocols to keep track of the personal protective equipment for workers, the additional monitoring for the residents, and to make arrangements to renovate the nurses' stations to prepare for the day when visitors will be allowed back to the facilities again. With all of this in mind, the well-being of residents is kept at the forefront. After long winter months, the residents are looking forward to enjoying time outside on their verandas. Fundamentally, we need to remember that these long-term care facilities are their homes, and the residents want to be able to freely use their spaces as the weather allows. Prohibiting visitors on the property, including visits through windows, is because we have to protect the elders in both the homes. The unpredictability of unscheduled visits to the property and potential for human error in disinfecting these outdoor spaces is an unnecessary risk at this time. Elders have a wealth of knowledge and experience to share with us. Our community's culture, language, tradition, and lives are too precious for us to lose. Please respect and help protect our elders. Nyawa for watching.